Hey guys, so this is a video about hallucinogen persisting perception disorder, also known as HPPD. HPPD is characterized by persisting mild visual hallucinations, usually following use of a hallucinogenic drug, but sometimes the symptoms can occur without the use of a hallucinogen. Although it's regarded as quite rare, I believe personally that it's very common, at least to some mild extent, especially after repeated use of hallucinogenics. Some hallucinogens which are known to cause HPPD include LSD, DMT, 2CE, 2CI, MDA, MDMA, psilocybin, so shrooms, PCP, and synthetic cannabis. The symptoms include visual snow, after images, trails on moving objects, flashing colors, and auras around objects. So visual snow sort of looks like this. It's similar to static and generally, in my experience, takes on RGB, so like red, green, or blue in dark spaces. But in well-lit rooms, if you're experiencing it, normally the colors are much harder to distinguish. And I would describe it as sort of looking like a bad video stream in the sense that it just kind of looks like the pixel quality of everything, of your actual vision, just isn't as good as it normally is. My day-to-day experience of this isn't very intense at all. A lot of the time I don't really get it, but if I drink a lot of coffee or smoke cannabis or pretty much any psychoactive substance will exacerbate it for me quite badly. Coffee not to, like caffeine to not a massive extent, but it does make it slightly worse. After images you probably experienced when staring at a light source and then looking away. So it's just like the image of what you were looking at will just stay in your vision, but it will be just like a block basically. So it will sort of look like this. With HPPD, it can be any object really. I don't really experience it very often myself. Again, if I've had a lot of caffeine or if I smoked cannabis the night before normally, then maybe the day afterwards I would still experience it to some extent. But it's normally like the odd occurrence for me, this symptom. So yeah, it doesn't really occur very often for me. Okay, so trails look like this. Um, I'm kind of glad because I didn't really experience this ever. And obviously I have like on hallucinogenic drugs, but when I haven't been taking them, I don't really get it normally, and I'm really glad because that would be pretty fucked. So if you experience this, I don't envy you at all. So flashing colors, I couldn't really think of a better way to explain this. It's more like flashes, just flashes, but it's very, very mild. It occurs normally on walls or in the background of what you're actually looking at. And in my experience, it's best described probably as like the same color as the wall will just appear to flash like a lighter and darker version of the color, probably like 6 times a second. It's not very noticeable, but if you pay attention to it, it does. You can notice it basically. It does become very apparent that it's there. So, like the auras or the halos sort of look like this. It's just kind of like the object will have like a glow around it. I don't really experience this very often. I've had it a couple of times when I've smoked cannabis, but for me, it actually happens with words. So the words will have this weird aura around them. But yeah, I don't really experience this very often. So all these symptoms can vary from day to day. Like I said, psychoactive substances generally increase the intensity of them. For me, cannabis does it quite a lot. Caffeine to a very mild extent, but it does make things like visual snow a lot more noticeable. Paying attention to the symptoms also make them a lot more noticeable. And focusing on other things other than them makes them like much less noticeable. So you won't, for me at least, if I'm doing work or something, or if I'm recording a video, I won't even notice they're there at all. Like not even in the slightest. I'm quite an observant person generally, so for me the symptoms are really easy to notice. But I've spoken to people before, and they haven't actually noticed that they had the symptoms. And when I explained what I was experiencing myself, they began to realize they were actually also experiencing it. And this is why I believe personally that it's a lot more common than people expect. The symptoms can be really mild, so you might not notice them, but I would probably say at least 1 in 3 people who have taken hallucinogens on a regular-ish basis do experience this to some extent. I mean, I'm just getting these numbers out of thin air because it's just my experience of meeting people, so it's probably not very accurate, but this is what I believe myself personally. Currently, there are no known psychological symptoms that occur alongside HPPD, other than just the visual hallucinations. However, a recent study did confirm that there is a brain dysfunction in the right lingual gyrus, I'm hoping I'm saying that right, in the patients who are experiencing these symptoms. So it may be likely that a treatment will be available for HPPD very soon, that given that they know what the problem is. My experience of HPPD has been really mild, I'd probably say, and not really affected my everyday life. However, HPPD can be much more intense than this, and if you feel like it's affecting your everyday life, then I would suggest cutting out all psychoactive substances and seeing a medical professional for some guidance. So if you like this video, give me a thumbs up, comment below, and subscribe. Thank you. Bye bye.